India's pharmaceutical industry is under unprecedented scrutiny. Hundreds of manufacturers now face shutdowns by the end of 2025 for failing to meet good manufacturing practice (GMP) standards. In fact, 60% of India's 8,500 small and medium-sized manufacturers fall into this category. This moment is being framed as a sudden regulatory tightening, but the scale of non-compliance suggests something else entirely. Years of deferred oversight finally catching up. Problems of this magnitude do not emerge overnight. It raises a deeper question. Has India been operating with a two-tier quality system? One standard for US and Europe, and a lower one for African countries and other low and middle income markets. Why is this important? It is important because Africa imports more than 70% of its medicines from India. If such a large proportion of Indian manufacturers are not GMP compliant, we must ask, are these medicines safe? In fact, we already know there have been deaths because of non-GMP compliant medicines coming from India. It's a long-standing and well-documented problem. To understand how we got here, 10 questions stand out. First, why did widespread GMP non-compliance in India persist for so long? The depth and breadth of deficiencies suggest regulatory gaps, delayed enforcement, or tolerance for non-GMP compliance by the Indian regulator that allowed poor practices to become the norm over many years. Second, was India's regulatory enforcement uneven depending on the size of the company and the export destination? Large firms exporting to US FDA and European markets faced greater scrutiny from Indian regulators, whilst manufacturers supplying to Africa and other low and middle income markets faced less oversight. This two-tier regulatory system is well documented and may have normalized lower standards for medicines destined for certain markets. Third, how effective was India's state-level oversight? India's decentralized regulatory system places much of the burden on state drug controllers. Did India ensure they were adequately resourced, trained, and incentivized to enforce GMP consistently across different regions? Fourth, did India prioritize cost-cutting and economic benefits over quality and safety for too long? India is well known as a supplier of low-cost medicines. But did the drive to keep cost minimal result in regulators delaying enforcement of GMP compliance, allowing substandard manufacturing to persist for too long in the name of affordability? We at Medicines for Africa believe that access without quality is no access at all. Therefore, flooding African markets with low-cost, poor-quality medicines doesn't improve access. It only makes things worse. Fifth, why did Indian regulators not act earlier on the multiple warning signals that have come up over the years? For more than a decade, international import alerts, quality failures, and product bans have surfaced repeatedly, often involving the same Indian companies. Why did these not trigger earlier system-wide reform by the Indian regulator? Sixth, did India's regulatory capacity keep pace with the rapid growth of its industry? India's pharmaceutical capacity expanded rapidly in a short amount of time, but did inspection capacity, laboratory infrastructure, and technical expertise expand accordingly? The evidence suggests that it did not, and regulatory capacity in India remains chronically overstretched today. Seventh, did the Indian regulator provide adequate GMP compliance support to manufacturers? Regulators don't just set the rules. They also provide technical support and facilitate compliance. Did the government provide meaningful technical support, finance options, or face transition pathways to help smaller firms upgrade sustainably to meet GMP standards? Or were they left to manage on their own? 8. Did Indian GMP standards align with global benchmarks in practice? Clearly not. When regulators ordered alignment with WHO GMP by the end of 2025, it exposed a widespread non-compliance, inadequate inspections, and weak enforcement, especially for products destined for Africa and other low and middle income markets. 9th, did national and international procurement policies reward non-compliance? Aggressive price controls and tendering systems by governments and international organizations may have encouraged cost-cutting amongst manufacturers in India. When faced with such price pressure and operating in a system that tolerates non-compliance, manufacturers may start to cut corners while sacrificing quality. Finally, why is the Indian regulator enforcing GMP compliance now? And why through a threat of mass closures rather than phased correction? One likely reason is that years of deferring GMP compliance left the regulator with few choices. Deficiencies accumulated whilst international scrutiny intensified, damaging the credibility of the Indian pharma ecosystem. Hence, the option now is decisive system-wide action to reassert regulatory authority and to signal a break from past tolerance of low quality. Every time regulators push for stricter GMP enforcement, the industry pushes back with threats of mass shutdowns, medicine shortages, and economic fallout, whilst trade associations amplify the risks, all giving a clear message: slow down or the system breaks. The choice for African countries is an impossible one. Continue to buy unsafe medicines or risk not having medicines at all. Patient safety is not part of the conversation. But bottom line is this: GMP enforcement is a corrective process that the industry should face, especially given how long the regulator has deferred it. Addressing it honestly is essential, not only for India's pharmaceutical credibility, but the health systems that depend on Indian medicines.